All right, I'm Arundel County Executive Stuart Pittman, and we are here today to introduce 3 new programs to improve our safety net, both for the victims and their families of COVID-19 and for residents who are suffering from the economic impacts of this recession that was created by the pandemic. So I've said over and over and over again that this pandemic has impacted our lowest wage workers, our lowest income residents, much more severely than people who are doing quite well. Than people who are doing well financially. There are national figures that show the bottom quarter of wage levels. People at that level of wages are 8 times more likely in this recession to lose their jobs than people at the top. And we've seen that around our county. All right. Oh, look at that. That's really loud now. I got to talk quieter. Okay. So people at the bottom end of the wage scale are 8 times more likely to lose their jobs in this pandemic than people at the top. And so it's absolutely essential that when we put together programs in the county, we focus on the most vulnerable folks. So there are 3 programs that we're going to announce today. But I want to just be clear that we have lots of other programs that are already in effect. Our Eviction Prevention program. Okay? All right. So we have other programs that are already operating. We have our Eviction Prevention program, which was the first in the state and that is working to help people from losing their homes. We have a food distribution system that was created by our team and a lot of our nonprofit partners as well that has been growing and is easily accessible. We have a food line, 410-222-FOOD. And we have business assistance and child care assistance as well. We're very proud of those programs, and we're going to continue to grow those. We're nowhere near the end of the pandemic, and we're certainly nowhere near the end of the economic impacts of the pandemic. So the 3 programs that we're going to talk about today, I'm going to introduce people that are going to tell you about each one. I'm going to jump in between and give you my rationale for why we're doing them. We have a COVID care coordination program that puts wraparound social services in place for the folks that have been tested positive, are quarantining, isolating, and have needs in their families that aren't being met. So that's in collaboration with our contact tracing operation in the health department. We have a COVID recovery and grief support program for the 200 and most likely 264, if you include the 12 who weren't tested, people who've lost their lives in our county to this pandemic, their families, as well as people who have had the virus and are suffering with mental health issues as a result of it. So that's going to fund mental health services, grief support for those families and those individuals. And then the reason that we're here at the water tower is that we have a water bill relief program. We have 20 times more people delinquent on their water bills than we had last year at this time, 20,000 people. And so we're going to be doing work to help them pay their bills so that they don't end up in foreclosure proceedings. So I'm going to start with COVID care coordination. I have our health officer, Dr. Nilesh Kalyanaraman. We have Pam Brown from the do we have Pam Brown from Partnership for Children? Okay, sorry, I have. And we have Carissa Gowan from our Department of Aging and Disabilities.
Thank you, County Executive Pittman, for your steadfast support for programs that lift up everyone in Anne Arundel County. As we know, COVID has impacted families throughout our county. Our contact tracers at the health department have worked with over 11,000 people with COVID and tens of thousands of contacts. A key part of our contact tracing is providing case management to help people get food on the table, pay their bills, and keep their housing so that they can manage isolation and quarantine. During this time when people are struggling, some folks need additional support, and the COVID Care Coordination Program is an extension of the Health Department's contact tracing program. It'll support vulnerable individuals and their families to navigate resources and complex systems after the initial 14-day isolation and quarantine period. It's an opportunity in our county to address health disparities and prevent furthering economic disparities in communities disproportionately impacted by COVID. This is a collaboration with the Partnership for Children, Youth, and Families and the Department of Aging and Disabilities. I'm happy to introduce Carissa Gowan, the Director of the Department of Aging and Disabilities, to share more detail about this program.
Okay, thank you, Dr. Kalyana. The COVID Care Coordination Team will provide resource coordination to communities experiencing higher positivity rates in Anne Arundel County. This team will provide rapid response facilitation to access programs and services through navigation of resources addressing critical and priority needs, which could be barriers to health, wellness, and reducing the spread of COVID-19. This dynamic partnership will connect individuals with lifelines of services and supports, such as temporary housing, food access, utility assistance, medication assistance, as well as other critical needs. We are grateful for County Executive Pittman and our partners to have the opportunity to provide necessary and immediate supports to the residents of Anne Arundel County. Joining us today are members from the COVID Care Coordination Team. I would like to introduce Tracy Cherry from the Partnership of Children, Youth, and Families, Rebecca Lindenberger, an RN with our program, and two bilingual case managers, Clemencia Pizzillo and Natalie Kishby. Ladies, would you like to say a few words?
Good morning, everyone. I'm Tracy Cherry from the Partnership for Children, Youth, and Families, and we provide basic needs and assist families with resources in the community. During this COVID-19 pandemic, we are working closely with the contract tracers. We are providing navigation services for those families who are in need of extensive navigation services. If any family needs assistance, please call our 1-800 number. It's our Systems of Care line. It's 1-800-485-0041.
Buenos días, mi nombre es Natalie Kishby, soy la navegadora bilingüe para Partnership y estamos proveyendo diferentes recursos, para la comunidad. Estamos proveyendo pagar biles y otros recursos. Por favor, poder llamar a nuestra línea 800-485-0041. Gracias.
Hi, I'm Clemi Pizzillo, and I'm the case manager. I am very excited to be part of this team, and I look forward to supporting the community by connecting people to resources. And yo soy Clemencia Pizzillo y estoy muy contenta de ser parte de este equipo y espero poder ayudar a la comunidad al proveer los recursos necesarios para salir adelante. Gracias.
So people may have heard that Anne Arundel County was the only county in the state, one of the only ones in the country, to stand up contact tracing from day one and do tracing on every single positive case. And that, unlike what some other jurisdictions have done with call centers that you contract with to do contact tracing, ours are local people. And when they talk to somebody who's tested positive, they find out what their needs are in their household, and they discover that those needs are not being met any other way. So it's really important. I'm thrilled that we've got all of our agencies working with our contact tracers to fulfill these needs. So The next one is COVID Recovery and Grief Support Program. Adrian Mickler from our mental health agency is gonna come up and talk about that. But I can't stress enough how important it is to provide services, mental health services, to people who are victims of this virus or whose family members have been victims of this virus. And with over 250 of our residents having died from this virus in much less than a year, since mid-March, I think as a community, because we don't know their names, and because they die alone without their families in hospitals, they're invisible to us. And I think it's so important that we step up and help to meet the needs of their family members and those who've recovered in a way that we haven't before. So that's what this program is. So Adrian, come on up and tell us how it's going to work.
Good morning. As the director for the Mental Health Agency, it gives me great pleasure to announce the Anne Arundel County COVID Recovery and Grief Support Program. Through this program, additional resources are being provided to our crisis response system. These funds will be used to help those individuals and families who call into the county warm line and have been directly affected by COVID. Individuals and families have experienced many types of loss during this pandemic. Lost employment, lost freedom due to isolation, missing once-in-a-lifetime milestones surrounded by family and friends. Many of our residents are seeking additional emotional support and need various treatment options and therapy. But many of these individuals who call are also experiencing financial barriers to this treatment due to the effects of COVID. These funds will help to alleviate those barriers and provide the urgent care appointments and, most importantly, the follow-up treatment that is needed. In another area of our crisis response system, the number of mobile crisis team dispatches has also increased. During this pandemic, the mobile crisis teams are experiencing an increase in the number of calls to accompany the police for death notifications. While not all deaths are directly attributable to COVID, there are also individuals who may have postponed much-needed health care and haven't gone to their physicians for things such as heart disease and other serious health conditions because they're afraid of contracting COVID. Families have lost loved ones because of the peripheral effects of COVID as well as the disease itself. Funds from this vital initiative will support access to grief counseling for individuals and family members who are coping with the loss of their loved ones, some of whom have passed while in a facility and the family was unable to be with them. Others have died at home. The effects of these types of situations often linger, and several therapy sessions may be needed to help guide a family through this type of trauma. I'm so appreciative that we're now able to bridge the gap for these families who need clinical support but do not have the means to access those services. I'd like to take a moment to express my gratitude to our county's leadership for giving our crisis response system the funding we need to provide access to these caring and compassionate services as we stand alongside those who are grieving and are able to provide needed mental health support. These funds will go a long way to help our community members restore hope. So we invite our residents to call our warm line 24/7, 365 at 410-768-5522, and our staff will help guide with any behavioral health challenges.
Thank you, Adrian. We've known all along that the mental health impacts of this pandemic are hard to measure and sometimes hard to address. So we're taking a step in the right direction to do that. So finally, water bill relief. Water bills don't seem like a big deal to most of us because we pay them along with some of our other bills, and compared to some of the others, they're not as large. But when we heard that there were 20,000 delinquent water bills and that the law requires that they go into foreclosure proceedings. We have to collect. The question was, can we use some of our CARES money to provide assistance to those families? And I want to note that these are homeowners. Renters who have not paid their water bills are being served by our Eviction Prevention program through Anne Arundel Community Development Services. So they're negotiating to help those renters pay their rent as well as other utilities. But for the homeowners, they're threatened with foreclosure in this situation. So we have, through our Anne Arundel Community Development Services, a system set up to actually pay these bills for folks. And so we have Karen Henry, Kathy Koch, and Karen McQuaid are going to come up and tell you how it's going to work.
Good morning. I'm Karen Henry with the Department of Public Works. The Department of Public Works' mission is to provide safe drinking water and enhanced wastewater treatment for the residents of Anne Arundel County. And the heart of that mission is met here in this location at our utility operations complex. We strive to keep our costs low so that water bills are affordable and we do not have to turn anyone's water off due to non-payment. When COVID-19 hit our county in March, we had no way of imagining that 6 months later we would have 20,000 residents unable to pay their water and wastewater bills, many of which are unable to pay because of loss of income due to COVID. Public Works is delighted that the county executive has made CARES funding available to Arundel Community Development Services, Inc. to fund the Water Bill Relief Program. The Water Bill Relief Program will provide assistance with water and wastewater bills to customers who have been economically impacted by COVID-19. For eligible residents, this funding will help to prevent DPW from having to turn off water due to non-payment. It will also help to prevent tax sale of property for residents with unpaid water or wastewater bills. The development of this program has been a collaborative effort with the County Executive's Office, the Office of Finance, the Department of Public Works, and Arundel Community Development Services. It is my pleasure to introduce Kathy Koch, Director of Arundel Community Development Services, to share the details of the Water Bill Relief Program.
Morning. I'm proud to be here as part of a partner working closely with our County Exec's Office, the Office of Finance, and our wonderful Department of Public Works. I'm Kathy Koch, the Executive Director for Arundel Community Development Services. That is the county's Housing and Community Development Agency. And we're offering financial assistance to homeowners who are unable to pay their water and wastewater sewer bill because they are experiencing financial difficulty due to COVID-19. To be eligible, you must be an Anne Arundel County resident, residing in your own home, and have a household income of 120% and below of the area median income. And you have had to have your income negatively affected by the pandemic. These funds will be made available to eligible applicants who will need help with paying their water bill and have received those water bills after March 1st, 2020. So if you are having a difficult time paying your current water bill or your water bills from March 1st, 2020, and you meet the other criteria, you are eligible to apply. Applications are being mailed to over the 20,000 applicants who are late, or clients who are late on their payments. So those applications are in the mail, so look for it in the mail. You can also get information on this program by going to www.acdsinc.org. This is important, that funds will be made on a first come, first served basis. So if you think you are eligible, we encourage you to get that application into us as soon as possible. Applications must be to us by December 15th, 2020. Okay, so first come, first served, get the applications into us. We expect a large response, so we encourage everybody to be patient. We will get back to you, and we encourage you to communicate with us through an email. And the email address is WBRP, for Water Bill Relief Program, so wbrp@acdsinc.org. Thank you.
So before we take questions, I just want to express my gratitude to all of these people who have not only are going to be administering these programs, but put them together, figured out how to make sure that they comply with the federal regulations and that they're going to be accessible easily to our residents. So thank you for helping us get the word out about these programs, because that's a big part of what we need to do. And I also want to thank our congresspeople and our senators for creating the CARES Act with the $100 million in funding to Anne Arundel County that's making it possible for us to do these programs. Let's hope that they get their act together and continue funding beyond the end of this year as we move forward. So any questions? Yeah.
Can you confirm how much from the CARES Act is going to each program?
Yes. $2 million for the water bills. And let me say that these numbers can be fluid because we set them based on what we thought the demand and the cost would be, but that we can actually supplement the funding if the demand is higher to some degree. The COVID Recovery and Grief Support Program, $185,650 budgeted. And then the COVID Care Coordination Program, $140,500. Yes.
How much of the CARES Act money remains available for programs like this?
So if you go to Open Arundel at aacounty.org, you can see we actually report all the money that's spent. There's a category of projects like this that aren't on there yet that are still in the pipeline. So we have things to spend all the money on so that we know it's going to get spent by the end of the year, but we're still moving some of those around, which is why we're able to add new programs. So you could say it's all spent, or you could say we still have another $25 or $30 million that's still, it's possible for us to adjust and move into better programs like this when we discover them.
It's required to spend it by the end of the year?
Yeah, it is. It is. Yep. Yeah.
Is the COVID care team made up of new hires, or is it reassigned from other departments?
COVID care team. Who's doing it?
So we actually have one existing employee, Clemencia Pizzillo, and also Natalie. So the position that we did hire was Rebecca, our registered nurse.
Thank you.
Yeah.
How many people were having trouble with their water bills like this time last year?
1,000.
Oh, okay.
We're at 20,000 now.
Wow.
Yeah.
Question for Ms. Midler. Can you provide any numbers for, you said that the crisis team calls were increased, but do you have any percentage of how much they're up?
From the same time last year, the calls to the landline are up roughly 20%, and the mobile team dispatches are up roughly 10%.
Thank you.
All right.
Question.
Thanks, everybody. Thanks for coming out. Oh, did you say you had more?
What?
Did you just say you had more questions?
Yeah, if that's okay.
Oh, yeah, go ahead. Yeah, of course.
So for the water bill relief program, and I kind of wondered this for the eviction prevention program too, like what exactly do residents need to show you to prove they've had their income impacted by the pandemic?
They basically just have
Why don't you come on up? That's it. We already have the forms and everything worked
We
out.
do,
so
we
you're-
do.
you need to come.
So with our eviction prevention program, our case managers are working one-on-one with the people coming through the system, and they need to tell us their story. People have lost their income due to a lot of different reasons, whether it's reduction in hours, reduction in tips that are collected, that they were collecting before. We see a lot of that. There's also people who can't work because of childcare. You know, kids are home and they have to be home. There's also people who can't work because they're vulnerable. They're in a risk category. So there's all kinds of different reasons. So with the water relief bill, because we have a short amount of time and we want to be able to turn this around, what we're asking people to do on the application is tell us your story. Tell us your story, whatever it is, and what happened to your income. Okay?
So you already mailed applications to the 20,000 homeowners who are delinquent.
The finance office has those. They're in, as they say, they're in the mail.
Okay.
Yeah.
And those are just homeowners, not renters. That's separate.
Renters are getting delinquent bills, so everybody with a delinquent bill is also getting mail, but the renter, the homeowner actually gets the copy too.
Okay.
So, and what we will do is encourage the renters will be encouraged to go to our eviction prevention program.
Okay. Thank you.
And all of these programs, as well as other existing programs, people can find at aacounty.org/coronavirus. All right, thank you, everybody.